Posture can be challenging when standing and walking if you have any issues with balance, weakness, stiffness, fatigue or your vision. Often, when you are walking, you are thinking more about where your feet are going rather than your posture. But it's important to maintain as good posture as possible because if you stand or walk in a poor posture, it might lead to back, neck or hip pain and use more energy and hence lead to increased fatigue. So look out for these warning signs. If you have weakness in your legs or fatigue, you may find standing for a while tricky and start to slouch. If you have altered sensation in your legs or feel unsteady, you might find yourself looking down and stooping more. You may also stoop or look down more if your vision is impaired in order to see better where you are going or identify obstacles. All these issues can affect your posture and lead to altered balance, back and neck ache. When you are walking, try and keep as upright as possible. Looking at something just above your eye line can help with this. To check for obstacles, try scanning a few metres ahead rather than looking directly down, as this can keep you more upright. When you then approach an obstacle, you can then look down briefly whilst you go around it and then look up again. When you have to stand for any length of time, to protect yourself from aches and possible falls, try and get into the habit of running through a simple checklist. For example, think head, shoulders, knees and toes to remind you, and ask yourself, is my head forward of my shoulders or to one side? If so, try and stand, keeping your head in midline, on top of and in line with your shoulders. You might find that using a mirror helpful initially to monitor corrections to your posture. Is my chin jutting forward? If yes, tuck it in, but make sure at the same time you do not hunch your shoulders. Consciously relax them down and back. What are my knees doing? If your legs are weak, there can be a tendency to lock your knees back or stand with your weight on one more leg than the other, which can cause your spine to curve sideways. So if your weight is more through one leg, position your feet slightly apart, in line with your shoulders, and divide your weight equally between them. Keep your bottom tucked in and your knees very slightly bent. This will help you engage your core muscles because they are better aligned, which gives you stability. Finally, if you find it hard to stand for any length of time when you notice that you're starting to slouch or sag, consider whether you could pace your activities. For example, try alternating standing activities with a sitting activity to give your legs a rest, or use a stool to perch on to do the task. For example, when you're preparing vegetables or at the sink or cooking. Perching stools are often available from social services, or you can buy them from a mobility shop or online. If you feel you may need one or experience any problems with the suggested postural advice in this film, discuss with your nurse or therapist. The same general advice applies if you find walking with a limp or dragging your feet after a while. Again, try and pace yourself. Rest regularly to allow your legs to recover if they are prone to fatigue, and consider using a walking aid for longer distances so you're walking as normally as you can. This can make your walking more efficient, less fatiguing, and are using more of the right muscles to help you walk rather than compensating with other muscles. Finally, if you're catching your toes or scuffing your feet when you're walking, which is known as foot drop, this may also affect the way you're walking, and your posture can be very fatiguing. If you have foot drop, you may benefit from an orthotic to help you pick your foot up. These come in many shapes and designs, and your doctor, nurse or therapist can help with a referral for assessment for one. We hope these tips have been useful. For more hints and tips on posture in different aspects of daily life, check out other videos in the series on our channel.
Recap. Think head, shoulders, knees and toes to help keep a good posture. Scan ahead when walking to avoid looking down too much. Poor posture can lead to pain, fatigue and uses more energy, so pace your activity. Consider a walking aid, perching stool or orthotic if needed. Ask a health professional for specialist equipment or advice.